Hi everyone. You know, I shoot short videos about medicine. Maybe it's boring for some, I'm not sure. This time, I wanted to share some memories. I hope this one will be a short and entertaining video. In fact, most of these memories feature various celebrities, but I will not be mentioning the names of the celebrities except for one, because in this first incident, I realized that it would be inconvenient for a celebrity to appear with me or have a photo taken with me or to be posted on social media with me. Okay, let's go. A few years ago, I was on vacation in Greece with friends. We were visiting the Hydra Island. While we were walking on the beach, we saw that Beyaz was over there. He was standing in front of a cafe with a friend. We said, "Hello, how are you, Beyaz? We are also staying here." And then we had a nice chat there. Then we decided to take a photo together. In fact, Beyaz grabbed my phone and wanted to take the photo himself. He took the selfie himself. Well, of course, we couldn't wait to share our photo with a celebrity such as Beyaz on social media like Instagram, Facebook, etc. And in a short time, messages began to flow under the posts. Friends and people who know me were asking, "Oh, have you operated Beyaz too? Did he have a problem?" I replied, "Gosh, don't be ridiculous. I'm on vacation at the Hydra Island in Greece. What's that got to do with operations? What the hell is this?" Actually, I knew they were kidding, but still, I don't think it's nice. Then the next day, we took the ferry on the return trip to the continent and saw what? Beyaz was there once again. This time we came across Beyaz on the ferry. As I passed by, I asked my friend if I should tell Beyaz about the comments on Facebook. Well, anyway, I went to him and said, "Beyaz, you know we had a photo taken with you yesterday, but then things got complicated." He looked confused and curious. He asked why, what happened? I said, "I'm a surgeon and everyone thinks that I have operated you." He couldn't understand and simply asked, "What is it? What's the problem?" I whispered towards his ear and said that I was best known for my penile enhancement procedures. He was surprised. "Are you serious?" I said, "Well, I think people are kidding. I mean, we are on vacation in Hydra, Greece. Of course, I'm not going to do surgery here." I tried to calm him down by saying that people were making jokes. There was no such thing for sure as we were on vacation. But Beyaz jumped out of his skin. So, I don't share my photos or memories concerning celebrities since that incident. You know, if I have some kind of a memory with a celebrity, relevant or not, okay? It is unpleasant to even hint at something like that. This is the private life of people. The surgery we perform is also a very private one. That's why I never shared a photo of myself with celebrities again. This was the first and the last. For instance, a couple of days ago, someone recently made a real nice joke about me. You know, we were in a place full of celebrities, actors and pop stars. There were famous cartoonists. And a friend introduced me to his other friends, saying, "This is Dr. Oytun, neurosurgeon," he said. I said, "Neurosurgeon? Bro, where did that come from?" He called everyone and said, "Hey, come along." He asked, "Where do you think is a Turkish man's brain located?" Everyone says, "It's in his dick." So exactly, he's a neurosurgeon, right? So it was a moment when we laughed out loud. I will never forget that. But unfortunately, I can't share any of those who were around with whom we took all those photos. Unfortunately, I have this habit. I do not have the stereotypical attitudes expected from a doctor. I can't wear a suit or something. One day, media professionals visited me at the clinic. One lady suggested to shoot a video. They made me an offer. I said that I shooted my videos on my own. Then she made a couple of suggestions. She suggested me to dress up smart, wear a suit, to have my diplomas, medical books in the background, and not to exceed 3 minutes in the videos. Well, I'm not such a person. And because I'm not that kind of a person, I've never shot any of those ordinary, boring doctor videos. Sometimes I shoot videos at my home, sometimes when there is no patient in the clinic. Formerly, I used to go to the clinic on Sundays and shoot them when no one was around, but nowadays I shoot them at home. You see, I've got comic books and stuff in the background, and I'm wearing a Dimmu Borgir t-shirt. So the videos I shoot sometimes take 1.5 hours. I can assure you that patients watch these videos from the beginning till the end, and it's not limited to just once. Sometimes there are people who watch it 2 or 3 times and then come to my clinic. So, I mean, I don't like to show off at all. It is useless. I don't like things that are unnecessary and have no purpose in life. Let me give you an example. One day, this posh lady came to our clinic. She said she used to get Botox at another clinic, but she had heard a lot about me. So I said, okay, I'm glad, come in, please lie down. I pulled the Botox out of the package. I was about to apply it when she went, won't you put a mark? I said, what mark? She said that the former doctor used to put a mark to where he would apply the injection. I said that he was older than me. He's much older than me. I know him. He's a senior doctor here in Nişantaşı. But if he still puts a mark on the Botox application site, well, I guess I will laugh at that. You are supposedly very professional and you are still putting a mark on the Botox application site? A totally useless show. It is foolish, it's silly. It has no other purpose than to make a drama out of the whole thing for the patient. I hate it. I do not like it at all. I get really angry at everything unnecessary, okay? I never waste my time with these. Someone wrote something like this for me on the internet. She wrote that I applied Botox very well, but my procedure took a long time. The reason it takes so long is because I only take the precise amount of Botox to be applied at once to the injector. And I inject all of it at one go, the exact amount, then I repeat the same procedure for the second injection on that area. I apply it at once, then the amount necessary for the area between the 2 eyebrows. Each time, I get the exact dose I'm going to inject. Finally, I make an injection on the forehead and finish it. So 4 injections. Why? Because if I drove up all the Botox amount in one go, I apply it here, there, between the eyebrows. If I apply the dose incorrectly, the dose to be applied to the forehead may be insufficient. To make sure I apply the exact dose to each area, I draw the exact dose I will apply each time, and thus all sites are injected one by one and exactly as they ought to be. This is not just a useless show, it's a technique that works. The risk of applying less Botox in one place and more in another is thus eliminated. If you draw up all the amount at once, the amount remaining for the last injection may be lacking. So I take no risk, one by one and exactly as they should be. Okay, it might take a while longer, it takes 2 more minutes at most, but it doesn't matter. The important thing is this. This is not a useless technique. I'm not doing anything in vain. I'm doing something that works. Making a mark with a pen, come on, excuse me, but I'm laughing out loud at that. My examination begins when the patient enters through the door. The mimics visible when the patient speaks demonstrates to what extent and how much the muscles inside there work. Plus, there is something called topographic anatomy. I have studied anatomy at university. When we look at the face, we know which muscle is where and which muscle causes which sort of wrinkle. If a doctor who is much older than me and much more experienced than me marks the site to apply Botox to in the clinic, just know that this is simply a useless show. It is no more than a ceremony. I don't think it makes any sense. I don't like such things. And then one day, a pop singer came in for Botox. To be frank, I didn't know that she had pop albums until that day. And she insisted on standing up during the Botox procedure. Well, I said I wouldn't apply it while she was standing because none of the injections should be applied while the patient is standing up. The patient's blood pressure may drop and she may fall down and hit her head. Injections can't be applied while standing up. Other clinics may have done it. That's none of my business. But it's not correct. I'm a man who adheres to medical rules very precisely. I won't apply injection while the patient is standing up. The patient's blood pressure may drop and she may hit her head somewhere. That would be horrible. I told her to please lie down. She insisted on standing up. I insisted on her lying down. It's not right, I said. Well, she continued to insist. Can you please lie down? I shouted so loud that the woman had to immediately lie down. She lied down and I applied the Botox that way. Well, she didn't come back again, okay. But I don't welcome such a misfit patient either. I really don't feel sorry for these patients going to other clinics. Because there are specific medical rules. If you act in breach of these rules, you will run into trouble. The reason for the complications and problems is violating these rules. I don't know if you have heard of it, but all kinds of trouble in the hospitals happen to the relatives of doctors. Why? Take an aunt or a sister of the doctor, and they may say, let's begin the surgery, I don't know, without doing the X-ray. There is no need for that analysis. Let's pull some strings. That's exactly why all kinds of trouble happen to the relatives of doctors. During my residency, I used to tell my friends in the emergency, if one day I have an accident and if they bring me here, don't pull any strings for me. Simply treat me like any normal citizen. Because whenever something is skipped because of that, if the patient is taken in before others, there will certainly be a medical problem. That's why you shouldn't violate medical rules. If possible, I hope that the patient who insists on having an injection while standing up won't come to me. I do not apply Botox while the patient is standing. I apply it when the patient is lying down, because in case you faint, fall down and hit your head, you will blame me. Whatever. I wanted to talk about a few moments like this. Let's cut it here so that the video doesn't get too long and you don't get bored. Thanks for listening. See you on the next video.